And joining me now is Dr. Jean-Jacques Zambrowski, a Professor of Public Health at the Paris Descartes University. Thank you very much for your time, Professor. Are French authorities taking all the right steps required to deal with this pandemic?
Definitely nowhere in the world was prepared really to what's happening now. And it's the global feeling that the time to find for who is responsible for what is not today. Although this afternoon the Prime Minister and the Minister of Health will answer the question of the Parliament members. But the question is, are we step by step, and as much as we learn from the Chinese and the South Korean, for example, taking the appropriate measures in terms of confinement and all the other answers. For example, as you've just said, there is a shortage not in the drugs to treat the COVID-19, but the people who are in the intensive care and resuscitation units, because they need some other drugs, and we do not have enough. They were finished in France. They were prepared in France, in French pharmaceutical factories, but the active ingredient very often came from Asia due to the price. You know, very cheap drugs can no longer be produced in our countries, or could no longer be produced in our countries for economic reasons. This is something we must think about and probably have better solutions, never to be in that situation of shortage.
As well, shouldn't we be testing more people here in France?
The decision has not been made, and one of the reasons was certainly that tests were not available for everyone, for just the reason I mentioned. You know, the tests are produced, or the kits are produced mainly overseas, and we definitely are not enough. So we decided to test only the people who had symptoms, except in the south of France, in Marseille, where Professor Raoult is proposing to test every citizen in the city and to treat at the very first stages of the steps of the disease those who have something. But the more the serology test will be available, the more everyone will be tested, and this definitely will be part of the next week's policy at the end of the confinement and containment policy. The way to slow down is generalized testing, localizing people, quarantine for those who are suspected of being infested with the disease. And this is the only strategy after the end of the generalized confinement. But testing is definitely something we should increase as early as we can have the test.
Professor Zambrowski from Paris Descartes University, thank you for your time.